Welcome to Pennsylvania in Focus. I'm Kristen Smith. Joining me today is the Center Square's Pennsylvania reporter, Christina Langell. Christina, how are you doing today?
Good, thanks. How are you?
I'm doing well, thanks. So earlier this week, you reported about Food Bucks, which is a program in Pennsylvania that would reward food stamps recipients for the types of food that they choose to buy. And you actually had a chance to speak with somebody directly who organizes this program and runs it on a smaller scale out in Pittsburgh. So tell us more about that.
Yeah, so I got an email from someone who is actually not currently a recipient of Food Bucks, expressing what a difference it makes in the communities where it is available. So I decided to go check out where they currently have it, because it's currently run by different nonprofits in different specific locations. So in this case, in Pittsburgh, there's a nonprofit called Just Harvest that allows people to use their EBT cards to purchase tokens that they can then use to buy fresh produce at farmers markets. When they buy those tokens, they also receive additional vouchers for money that they can spend at the farmers market. And then at the end of the day, the farmers square up with the organization and get the cash receipts. So that makes it so that food stamp recipients can use those funds in places that they might not otherwise be able to use them. And it also, of course, gives the added incentive. You're getting more value for the same amount of money or the same amount of food stamps when you get additional vouchers or credits, which is what is being proposed in a bill that's moving through the House soon.
And what's interesting about this bill, as we've mentioned in prior reporting, is not that it limits what people can buy, but rather incentivizes, because there is in the era of Make America Healthy Again, there is, of course, a lot of concern about the kind of foods that we are eating and how that's impacting our health. And I think that there is while there is obviously support for helping people in all income brackets to access healthy food, there's also the reality that it's not accessible for many. So will you talk more about why it's important to incentivize and not restrict?
Yes. So that is a big conversation that's been happening. Certain states have been moving to change their SNAP laws using waivers, because SNAP is a federal program. So those rules are federally set, but then they can use waivers at the state level to change what's allowed within the program. And a lot of people are saying, well, it's not good for people's health to be eating processed food, sugar, junk food. We should just make those foods ineligible for SNAP recipients. For a lot of people who are living in poverty, however, it's not so easy to just go buy fresh produce. I actually spoke with a woman, Amy Salmon, and she is currently battling myeloma, which is an incurable type of cancer. She talked to me about how the only place that she can really buy groceries without a car that's really accessible for her in Washington County, which is just south of Pittsburgh, is the local Dollar General. And so we've all been to a Dollar General, and we know they do have food. Like you could subsist off of only eating food from there, but it's not going to be the healthiest choices. But that's what's available. So it's really hard. And that's what's affordable as well, because we all know that buying organic or buying produce is not something that's always so easy to do. So she described to me her situation receiving chemo, and chemo, of course, really depletes nutrients from your body. And so her doctors and nutritionists really emphasized the need to eat healthy while she was going through treatment. But in terms of what you can afford and what you can buy on food stamps, she had to, really eat a lot of like hot dogs and just junk food to try to put the weight back on. So we see it sort of has this cascading effects on health. Even the studies show that any food, whether it's healthy or unhealthy food, is better for Medicaid costs and our health care in general than when people are going hungry. But certainly people would love to eat healthy food if they could. So when we make it more accessible and more available, that seems to work better than limiting options from people who might not really have access to much.
Right. And of course, if this program were to be enacted statewide, this would incentivize people no matter where they're shopping. So if they can only get to a farmer's market, say that they would have an opportunity there. But even at your local grocery store, this is going to still work, right?
Yes, in theory, but it would be operated by nonprofits. SNAP itself is actually operated by the Department of Health and Human Services. The Department of Human Services. Is thinking federal, not state. So SNAP is operated at the state level by them, but this program, Food Bucks, would be operated by nonprofits. So I'm still not clear from reading that bill how exactly. I suppose they would just each manage it in their own way. Other states do have these kinds of programs, but they're operating on a much larger level with a lot more investment from the state. And so it has more of that umbrella structure to it. I think that one of the reasons it's appealing to the state is that it's not adding an additional burden to any state agency to do this. So it should be available at grocery stores. It certainly would be available at some grocery stores, but I couldn't say as to if it would be available at every grocery store. All
right, Christina, thanks for joining us today. To keep up with this story and more, follow us at thecentersquare.com/Pennsylvania.